want to thank you guys for coming tonight.
Yes, sir.
My name is Dakota Nicely. I'm a firefighter paramedic here with Adamsville. I'm also a critical care paramedic in a community ambulance, and I'm also a certified CPR instructor. I wanted to talk to you a little bit tonight to inform you and hopefully convince you to take a CPR class for anyone who's not certified. So I'm going to give you a little scenario. I want you to think about it. It's a rainy Saturday, so you decide to go do your shopping at Walmart. You do your shopping, you're standing in the checkout line, and you see the guy in front of you. He's in his mid to late 60s. You notice he looks kind of pale, kind of clammy, and all at once he collapses. I want you to stop right there, and I want you to think for a second. Do you know what to do? Or does anybody around you know what to do? If you know what to do, you might be able to save this guy's life. So what is CPR? CPR stands for cardiopulmonary resuscitation, and it is the act of manually pumping blood through someone's heart via chest compressions in the event of cardiac arrest. So to understand this a little bit, we need to talk about what exactly sudden cardiac arrest means. Sudden cardiac arrest is the sudden, unexpected loss of a pulse due to a heart-related issue, whether it be a heart attack, cardiac dysrhythmia. Sudden cardiac arrest does not include trauma-related incidents or illness-related incidents. Therefore, cancers, car wrecks, stuff like that, it's not necessarily a sudden onset. Sudden onset would mean, like, if I'm standing up here talking to you and I collapse right now, that's sudden cardiac arrest. It's important to understand that it can happen at any time, any place. So what if you are trained? Would it really help? The answer is yes. Studies show that early bystander CPR can actually increase the victim's chance of survival greatly. If you're trained in CPR, you know what this is. This is called the chain of survival, and it's a acronym that we use to instruct and tell about the chain of events. If you're CPR certified, you can actually do the first three of these. The first step is to call for help, which anybody can do. The next step in the chain of survival is early bystander CPR. Okay? And then the step after that is early defibrillation, which you could do if you were trained in the use of an AED. Without any one of these links, the victim's chances of survival decrease greatly. So the farther we can move down this chain, the quicker, the better outcome we would expect that victim to have. So now you're kind of thinking maybe, yeah, that's not my place, that's not my job, not the paramedic's job. That's what we call for, they're supposed to come and do this, right? Not always, that's not always true. Recent studies show that bystander CPR at the first sign of sudden onset cardiac arrest greatly increases the chance of a victim's survival. Statistics are now showing that for every 1 minute a person is in cardiac arrest, their chance of survival decreases by 10%. Furthermore, studies show that after 10 minutes of cardiac arrest without CPR, even advanced life support procedures may be ineffective. Meaning like the arrival of the paramedics, getting cardiac drugs on board, stuff such as intubation, the more advanced stuff that you would expect when EMS arrives. So depending on your location, especially in our territory out here, let's say you're in Otsego and you witness a sudden cardiac arrest, it will be probably much greater than 10 minutes before EMS gets there. Think about a volunteer department. You've got to call 911. the call has to be received, we have to be dispatched, and we all have to get here to get to an ambulance to get to the scene. So you're looking at probably a 15 to 20 minute time for EMS to arrive. So now how does CPR come into play here? How does that change things? With good quality CPR, someone who's trained, you're actually circulating the blood through the body. So you're getting oxygen to vital organs such as the brain, the heart, and you're actually stopping that clock. You're extending that 10-minute range of survivability. If you're doing good CPR, if you're doing it properly, you'll actually feel a pulse. And so that's a good thing to delay that 10 minutes. So here you can kind of see, here's a chart of good effective CPR. It's kind of showing, here's your time up to 10 minutes, and here's your percentage of chance of survivability. So you can see that it's delaying that and keeping your chances of survivability high. Here is cardiac arrest without CPR. You can see at even the 5-minute mark, we're below a 50-50 chance of getting that victim back. Even with EMS interventions. So you think, what are the chances I may actually get to use this? Statistics are now showing that approximately each year, 295,000 out-of-hospital cases of sudden cardiac arrest. That's not in a squad, that's not in an ER, that's Walmart, the mall, the restaurant, that's everywhere, out of hospital. Is it difficult to become certified? No, it's not. You can usually take a class in one day. They range anywhere from 4 to 6 hours. It can cost as little as $5. We've done things here in the past for citizens that live in our fire territory. We charge them $5. That's the cost that we have in it. So it's very easy to become certified. Where do you start? You can talk to me, you can talk to Josh. You can also go online to the American Safety and Health Institute, or ASHI, the American Heart Association, or the American Red Cross. And you can find information on how to become certified there. So, hopefully this has informed you and enlightened you on the importance of CPR by bystanders. Whether you have medical training or not, understand that there are hundreds of people just like you every day that may have to perform CPR. And so I want to leave you with this question. If one day you witness this sudden cardiac arrest, we know what to do. We'd be ready. So hopefully you go out and think about taking a CPR class. Thank you.